Let's see the treatment of chronic gout. First is uricosuric agents like probenecid and sulfenpyrazone. Probenecid and sulfipyrazone are uricosuric agents. They inhibit the active tubular reabsorption of uric acid in proximal tubules and increase the excretion of uric acid. So they inhibit the active tubular reabsorption of uric acid. They inhibit the active tubular reabsorption of uric acid in proximal tubules and increase the excretion of uric acid. Example probenecid and sulfenpyrazone. They are rapid acting but poorly tolerated. High fluid intake is advised to prevent the formation of urate crystals in urine. So, this is the advice that we will give: high fluid intake to prevent the formation of urate crystals in urine. High fluid intake. Sulfenpyrazone is an alternative to probenecid. Sulfenpyrazone is an alternative to probenecid. Uricosuric drug should not be given within 3 weeks of an acute attack of gout. They mobilize uric acid from tophaceous deposit. Hence, there is fluctuation in serum uric acid level, which can precipitate acute gout. So, uricosuric agent, they can precipitate acute gout. The drugs are contraindicated in patients with renal failure. Side effects are rare, but GI toxicity like nausea, vomiting, and skin rashes may occur. Let's see the drug interaction of probenecid and beta-lactam antibiotics like penicillins and cephalosporins. They are excreted by active tubular secretion. When they are administered simultaneously, probenecid competes with penicillins and cephalosporins and blocks the tubular secretion of beta-lactam antibiotics. Therefore, plasma level of beta-lactam antibiotics and their duration increases. Thus, the treatment becomes more effective. So, probenecid और पेनिसिलिन्स या सेफालोस्पोरेंस ये सारे एक्टिव ट्यूब्यूलर सीक्रेशन से एक्सक्रीट होते हैं. तो व्हेन probenecid and penicillins are administered simultaneously, the probenecid will compete with cephalosporin and penicillin, and probenecid will block the tubular secretion of beta lactam antibiotics, जिसके कारण उनका सीक्रेशन नहीं होगा, तो उनका ड्यूरेशन ऑफ एक्शन इंक्रीज़ हो जाएगा, उनका प्लाज्मा लेवल इंक्रीज़ हो जाएगा. प्रोबेनिसिड के कारण पेनिसिलिन्स का ड्यूरेशन ऑफ एक्शन और प्लाज्मा लेवल इंक्रीज़ हो जाता है एंड दस ट्रीटमेंट बिकम मोर इफेक्टिव. तो प्रोबेनिसिड के कारण जो पेनिसिलिन्स होते हैं दे बिकम लॉन्गर एक्टिंग. नेक्स्ट इज allopurinol. Allopurinol prevents the synthesis of uric acid. It prevents the synthesis of uric acid by inhibiting the enzyme xanthan oxidase, thus reduces the plasma urate level. Xanthan oxidase को inhibit करता है, जिसके कारण uric acid का synthesis prevent होता है. Its active metabolite alloxanthin is a non-competitive inhibitor of xanthan oxidase inhibitor. इसका active component क्या है? Alloxanthin. And it is a non-competitive inhibitor of xanthan oxidase enzyme. It reduces urate crystals in kidney, joints, and soft tissue. There is increase in the level of xanthan and hypoxanthin in the plasma, which are effectively excreted in urine. See? तो फिजियोलॉजिकली क्या होता है? xanthan is converted to hypoxanthin, hypoxanthin is converted to uric acid, and this is because of xanthan oxidase. Xanthan oxidase converts xanthan into hypoxanthin, and then xanthan oxidase only converts hypoxanthin into uric acid. So if xanthan oxidase is inhibited, then uric acid का level कम हो जाएगा और hypoxanthin और xanthan का level increase हो जाएगा. And these are excreted in the urine. Allopurinol is administered orally and is the drug of choice for asymptomatic gout. It is used in chronic gout as well as hyperuricemia associated with cancer, chemotherapy, radiation, or renal diseases. Route of administration oral. Uses asymptomatic gout, chronic gout, and hyperuricemia. It should not be started within 3 weeks of an acute attack of gout. ठीक है, probenecid के जो यूरिकोसूरिक एजेंट्स थे, they should also not be started within 3 weeks of acute gout, as it may precipitate another attack. Allopurinol is also useful in Kala Azar. Adverse effects of allopurinol: hypersensitivity reactions like skin rashes, itching, erythema, headache, fever, and rarely Stevens Johnson syndrome may occur. Skin rashes, itching, erythema, headache, fever, and Stevens Johnson syndrome. GID effects like nausea, vomiting, diarrhea, and occasionally hepatotoxicity. Allopurinol is contraindicated in children, pregnancy, lactation, patients with liver and kidney disease. Allopurinol is contraindicated in children, pregnancy, lactation. चिल्ड्रन में नहीं देंगे, प्रेगनेंसी में नहीं देंगे, लैक्टेशन में नहीं देंगे, और लिवर और किडनी डिजीज़ के पेशेंट में एलोप्यूरिनॉल नहीं देते हैं. Let's see the drug interaction of allopurinol and 6-mercaptopurine. 6-mercaptopurine is converted to thiouuric acid by xanthan oxidase. 6-mercaptopurine is converted to thiouuric acid by xanthan oxidase. Okay. And allopurinol inhibits xanthan oxidase. Allopurinol inhibits with the metabolism of 6-mercaptopurine by inhibiting the enzyme xanthan oxidase and increases its effect. So allopurinol के कारण 6-mercaptopurine का effect increase होता है. Thus allopurinol is commonly used in cancer treatment. Cancer patient receiving chemotherapy to reduce hyperuricemia and decrease the dose of 6-mercaptopurine and its side effect. The 6-mercaptopurine is converted to thiouuric acid by xanthan oxidase, और allopurinol जो है it inhibits xanthan oxidase and thus increases its effect. So allopurinol is commonly used in cancer patients receiving chemotherapy to reduce hyperuricemia, जिसके कारण 6-mercaptopurine का डोज कम होगा तो साइड इफ़ेक्ट्स भी कम होंगे. Then febuxostate. Febuxostate is a xanthan oxidase inhibitor. It decreases the formation of uric acid. It is administered orally once daily dose is used for chronic gout. Adverse effects include diarrhea, headache, hepatotoxicity. Febuxostate can be used in gout in patients intolerant to allopurinol. So febuxostate, this is also a xanthan oxidase inhibitor. Route of administration oral. Once daily dose is used. Use in chronic gout resistant to or intolerant to allopurinol. So febuxostate is used in gout in patient intolerant to allopurinol. We have rasburicase and pegloticase. Rasburicase. It is a urate oxidase. It is a urate oxidase produced by recombinant technology. Urate oxidase. It converts uric acid to soluble allantoin. तो rasburicase जो है वो यूरिक एसिड को एलेंटोइन में कन्वर्ट करता है विच इज़ एक्सक्रीटेड इन यूरिन. rasburicase इज़ अ यूरेट ऑक्सीडेज. ये यूरिक एसिड को एलेंटोइन में कन्वर्ट करता है विच इज़ सॉल्युबल एंड इज एक्सक्रीटेड इन यूरिन. rasburicase यूरिक एसिड को एलेंटोइन में कन्वर्ट करता है विच इज़ एक्सक्रीटेड इन यूरिन. It is infused to decrease serum uric acid levels in children with leukemia or anti-cancer drug therapy. Hemolysis, gastrointestinal disturbances, hypersensitivity may occur. Okay, so rasburicase is used to decrease the serum uric acid levels in children with leukemia or anti-cancer drug therapy. Pegloticase, it converts uric acid to allantoin which is soluble and easily excreted in urine. It is administered as IV infusion. Okay, pegloticase का route of administration होता है IV infusion. In cases not responding to other drugs, anaphylaxis can occur. है, तो ये जो रास्प्यूरिकेस और पेग्लोटिकेस है ये यूरिक एसिड को एलेंटोइन में कन्वर्ट करते हैं विच इज़ एक्सक्रीटेड इन द यूरिन। ठीक है, फ्लुवॉक्सोस्टेट जो था वो ज़ैंथन ऑक्सीडेज इनहिबिटर था, ठीक है, जिसके कारण यूरिक एसिड का फॉर्मेशन कम हो रहा था। दिस इज़ द ड्रग इंटरैक्शन ऑफ allopurinol and 6-mercaptopurine.